Mental health is complex, but whether you're dealing with depression, anxiety, or stress, all of the basic treatment options are the same. I call these the 3 pillars of mental health treatment. And notably, almost all of these are self-directed without the actual need to see your family doctor. Number one is counseling. I cannot emphasize this enough. Formal counseling by an objective expert is the most important, and yet it's the suggestion that is most frequently overlooked or dismissed by patients. I've got a lot of other options noted on my website. An employee assistance program, if you have one, might be the best and fastest option. Locally, we have Access Mental Health and Addictions, your single point of access for help. And if you're a patient of mine, our family health team has mental health counseling, but unfortunately the wait times can be a little long. And you can see on my website, I've got a number of other resources to try, including online self-directed resources. Note that pretty much all of these are self-referral. You do not need to see your family doctor to get started. And in keeping with my number one suggestion, if you contact me regarding a mental health concern and you haven't yet started counseling, I'm going to ask you, why not? Number 2 is healthy lifestyle. Basically, don't do drugs, avoid alcohol, avoid smoking, remove these from the equation. Eat healthy, exercise, focus on proper sleep hygiene. These may all sound overly simple and cliche, but they are very important to your mental health and overall health. Number 3, medications. For some people, medications can play a role, but notice that I have not listed medications as the number 1 or number 2 pillar or suggestion. You cannot just take a pill and expect your mental health symptoms to disappear without addressing the need for counseling and healthy lifestyle. Anxiety and depression medications can take a few weeks to take effect, so there's often no hurry to jump to a prescription. First, ensure that you are already tending to pillar 1 and number 2. Notice that with pillar number 3, here is where my role as a family doctor can come in, recommending and prescribing a medication. If you are not interested in a medication nor ready, that is absolutely fine. But notice that all of the other advice here is self-directed and self-referral. It often does not require an in-person appointment with your family doctor. A word about crisis. If you are feeling urgently unwell or unsafe, then contact your local mental health crisis number, or even call 911 or go to your local emergency department for help. So while mental health is absolutely challenging and distressing, the treatment and options can be broken down into 3 simple pillars. 1, counseling, 2, healthy lifestyle, and 3, possibly medications.